Hi, this is Dr. Jonathan Yousef, networking for your optimal health. The goal of this podcast is to optimize your health. To achieve this goal, I'm going to discuss the most common medical concerns that I find in my practice. The objective is to take the top 5 medical issues that my patients complain of, and I will create a podcast for each one of them, providing just a little more information during their office visit. The series is intended to supplement a regular office visit for my patients or for any listeners, and to get a little bit more insight into their medical health. Hey, this is going to be in the comfort of your own home or car. Without further ado, I will begin the show. Hi, this is Dr. Jonathan Yousef, and this is Networking for Your Optimal Health. My healthcare series continues with hormone replacement therapy. My goal today is to talk about some of the symptoms my patients ask me about. Let's start with fatigue, which is a big common issue, low libido, poor muscle tone, hot flashes, mood swings, night sweats, hair and skin changes, a condition called adrenal fatigue. What causes these types of issues, and what types of treatments do we have available? I think that's the heart of what my patients and my listeners are asking. So let's talk about hormone replacement therapy. Specifically for men, I think the major hormone that we're talking about is testosterone. Testosterone can be used for multiple symptoms, and the concern I have, of course, is that it has some side effects, but one of the benefits of hormone replacement therapy, and specifically bioidentical hormone therapy, is that it can try and replace your natural hormones that you had in your body. So when we're younger, obviously our hormone levels tend to be higher. As we get older, they tend to go down, and that's normal. And of course, some of us decide, hey, that's not anything that needs to be treated, but rather something that is natural. So we could allow nature to take its course. But for my many patients that come in that are having issues with muscle aches and pains, fatigue, low libido, sleeping after dinner, I recommend and prescribe testosterone for them. So testosterone is a hormone, and this is the typical male hormone. The side effects of testosterone, or the concerns that I have with it, are that it can cause the prostate to enlarge. We are aware that those patients with history of prostate cancer should consider not taking testosterone, because it can sometimes be considered accelerated to the prostate cancer. We also want to make sure that those patients who are fertile, who want to have kids, don't take testosterone as their first choice in helping their symptoms, but rather look at alternatives, and there is some out there. The other concerns that we have with testosterone is the heart conditions. So some people think that it increases your cardiovascular risk as you get older, and the cases and studies to prove this have not been conclusive. So I don't want to give everybody the impression that testosterone is bad for you, but the truth of the matter is it is actually excellent and is more like your natural hormones in your body. So keep that in mind when you're thinking about testosterone treatments. I have many options, and I also have some medications that can stop the side effects or halt the side effects or prevent the side effects, and there are multiple kinds, and I can get into those, but it would take me hours to get through that. So I want to talk about female hormones. My favorite for female hormones, and sometimes for male, is progesterone. Progesterone has a great deal of benefits. In fact, it helps with hair and skin and headaches and sleeping, and improves sleep. So we have multiple benefits of using progesterone, and that just on a clinical level, I'm getting these kinds of results for my patients. The truth is, I try to balance the hormones. So if I have an elevated testosterone or estrogen and a low progesterone, I need to bring that up. I find that progesterone is very safe. I have not had any patients with side effects. I don't see any research or concerns about causing cardiovascular problems or breast cancer. I am concerned about estrogen, which is my next topic. I love it for patients with hot flashes, mood swings, and night sweats. That's typically symptoms, or even vaginal dryness, and those are typical symptoms of low estrogen. And so what I recommend for those patients are hormone replacement bioidenticals, including estrogens. The method in which I start is by using testosterone cream, estrogen creams, or progesterone creams. I also consider progesterone pill. It's cost effective and easy to take. Although it's not bioidentical, I still think it's cost effective. Nature helps patients be more compliant. My goal is to optimize someone's hormones when they come in. Of course, not everybody is interested in optimizing their hormones, and maybe everybody's goals are and wishes are different. So when somebody comes in, I want to evaluate them, give them my recommendations, and look at some options for them. To touch on a little bit about the thyroid health in particular, thyroid health is important for all of your hormones in your system. And I like to use a natural product called WP Thyroid. It is, for many reasons, better than I think the synthetic hormones, since it's, again, more similar to what your natural body's hormones are, which are the T4 and the T3. So there's definitely controversy when it comes to hormone therapy, but I could assure you that the years of experience that we have in the clinic here, plus the clinics that have opened up and are familiar with this kind of stuff, prove that this is a very valuable resource for physicians. So, thank you for talking or listening to our topic today. This is Dr. Jonathan Yousef, optimizing and networking for your optimal health. Thank you.